Minister of State for Health and Social Welfare, Dr. Isiaq Salako, has outlined the ministry's ongoing efforts to mediate between the federal government and the Nigerian Association of Resident Doctors, NARD, to improve the welfare of resident doctors and avert potential strikes. Speaking during a press briefing in Abuja, Dr. Salako said the ministry has maintained continuous engagement with NARD leadership to address key concerns including remuneration, training, and working conditions.
Ideally, one of the key requirements of CBA is that while it is going on, it is ongoing, there should be no declaration of industrial disputes. But despite that, we met with NATS. I met with them twice last week. The Minister of Finance has met with them. The Minister of Labour and Productivity has met with them. Minister of State for Finance has also met with them to try and address all the 19-point issues that they raised. And today, I can tell you that most of those issues are being addressed. First, they spoke about unregulated work hours and prolonged call duties, mainly due to what they call shortage of manpower. Let me use this opportunity to inform Nigerians that in 2024 alone, the Federal Ministry of Health, using a special waiver mechanism that no other sector enjoys, we were able to engage 14,444 health workers across 64 federal tertiary health institutions.
He stated that a special task force has been set up to monitor hospitals and ensure that medical services continue uninterrupted, especially in facilities where non-resident doctors are not reporting for duty. Dr. Salako reaffirmed government's commitment to strengthening industrial harmony in the health sector, stressing that the dialogue remains the most effective tool for resolving disputes.
We have also put together a committee in the ministry to develop a universal protocol for engagement of locum staff in our hospitals. And resident doctors have been asked to nominate 2 people to work with the ministry on that committee. And we have developed a policy around health workers migration that we are using to address the shortage of manpower in the health sector in Nigeria. We are expanding our capacity to train health workers. The President has approved the increase of the retirement age for clinical health workers to 65 years. And that process is just going through the establishment procedures for it to become active and implemented. So these are mechanisms that we have put in place to ensure that we address these issues.
Also speaking at the briefing, Chief Medical Director of the Federal Medical Center, Kefi Nasarawa State, Dr. Ibrahim Adamu, commended the federal government's proactive approach, stressing that effective communication between the government and medical professionals is vital for sustained quality healthcare delivery nationwide. He added that the ongoing strike would not affect operations at health facilities.
Today is officially beginning the first day of the working day of their strike, and we had a meeting over the weekend on Zoom of all chief executives in Nigeria, where we tried to discuss this strike that have already started. As at that Saturday, we all agreed that as much as possible, we will ensure that the controllers maintain and run our outpatient clinics to the best of their ability, which within the number they can take. And all our emergency services, we try as much as possible to keep them open and running. And I know, to the best of my knowledge, this morning, most of the federal tertiary institutions are maintaining their clinics.
With the strike on the way, federal government has reaffirmed its commitment to resolving the issues raised by the association and improving doctors' welfare. It assured that the dialogue with NARD's leadership remains ongoing to ensure swift resolution, restore normal hospital operations, and safeguard uninterrupted healthcare services nationwide.